My presentation is on benzodiazepines. They are the medications used to treat anxiety. So all of us have probably experienced anxiety at one point or another, and if it's felt properly, it's actually a good thing. It keeps us out of harm's way and keeps us alert. However, if it's felt in a disproportionate manner, it usually means that there's a fear response that is not proportionate to the actual danger that's being posed. So I have a small diagram here. I don't know if it'll help, but the way anxiety works is you first have your sensory organs that perceive that there's a potential danger. Then your brain responds with either fight or flight, which is the response that your body poses to danger. At that point, your brain then sends signals to your body to prepare for danger, and your body starts to produce anxiety symptoms such as your heart racing, dizziness, chills, difficulty breathing, anxious thoughts. And at that point, your senses perceive that these symptoms are dangerous. It then registers with the brain that there is a perceived danger, and this cycle goes over and over. So your mind then reacts to the anxiety response, which creates more symptoms, and the cycle continues. Now, that's the way anxiety works, and scientists don't know exactly what the cause is for anxiety. However, the brain is definitely involved. The scientists have discovered that the amygdala, and the hippocampus both play significant roles in anxiety. The whole limbic system does, but just to keep it simple, the amygdala is an almond-shaped structure that is in the brain that is the communications hub between the parts of the brain that process incoming sensory signals and the parts that actually interpret these signals. It alerts the rest of the brain that there's a threat that's present and triggers the fear or anxiety response, which I was mentioning before. Now, the emotional memories stored in the central part of the amygdala, they may play a role in anxiety disorders. And then the hippocampus is the part of the brain that encodes the threatening events into actual memories. So that's just a little overview of how anxiety works. Anxiety is probably a combination of your genetics and your environment. So for instance, if you grow up in an environment where there's frequent yelling or abuse, it might make you more prone to looking out for potential threats. So even when there's no potential threat there, in a sense, your brain has become wired for anxiety, so that any potentially undesirable event or emotion is a cause for alarm. So we know the brain has part to do with it. Also, environment has a little bit to play in it. And anxiety is something that can be debilitating. So a lot of people are prescribed medications such as benzodiazepines. They're the leading treatment for anxiety disorders, and they offer short-term relief for that anxiety. They're also used for seizures, insomnia, muscle relaxation, alcohol withdrawal, and panic attacks. They account for 90% of the anxiolytic market, and the anxiolytic medications are those that are used to treat acute anxiety. They're effective in reducing the anxiety or the symptoms, the anxiety-related symptoms, in 70 to 80% of the people. So they do work in most individuals, and they account for 90% of the market of the medications for acute anxiety. Now, benzos, which is the short way of saying benzodiazepines, they produce central nervous system depression. They affect the way certain brain chemicals transmit messages to the brain cells. So we have GABA, which is a neurotransmitter. Another little diagram, I don't know if that'll help. But basically, GABA is an inhibitory neurotransmitter, and it plays a role in relief from anxiety. GABA functions in a way that calms the organism. So benzos facilitate the binding of GABA to GABA receptors without actually stimulating GABA. They also facilitate the flow of chloride into the neuron to decrease its excitability. So there's two types, GABA A and GABA B. GABA A is the target of benzos, whereas the B receptors, when they're stimulated, will exert an inhibitory influence by decreasing the amount of potassium. Potassium is excitatory, and decreasing it will inhibit the cells. So that's how benzodiazepines work. Excuse me. Now, there are 5 families of benzos, and they vary in their potency, duration, and amount of time they take to clear the body. Some of the approved benzodiazepines in the United States include, and these are the brand names, Xanax, Librium, Klonopin, Valium, Xerax, Restoril, Doral. Now for Xanax, that's the brand name. The generic name is alprazolam. For Klonopin, the generic name is clonazepam. So they have different generic and brand names. We tend to know Xanax the best, but both Xanax and Klonopin, for example, they have an intermediate onset of action. Some work quicker, like I mentioned before, than others. But for example purposes, Xanax, it'll work within 30 to 60 minutes. How long it stays in your system depends on the half-life, the length of time that they've been taken, and the dosage. So typically Xanax has a duration of 11 to 20 hours. And just to have for comparison, Klonopin is 1 to 3 days. The shorter half-life requires more frequent dosing and produce withdrawal symptoms quicker. So that half-life is referring to the amount of time required for the amount of drug in the body to be reduced by half of its concentration. So all of these different benzodiazepines have different half-lives depending on what the purpose is for taking this medication. Now, benzos are also stored in the body fat, so they can continue to produce effects even days after people stop taking them. Now, the side effects of benzos include impaired motor coordination, drowsiness, fatigue, impaired thinking, confusion, depression, slurred speech, respiratory depression, nausea, mood swings. Blood testing is not required to take it, but it's very important to know what the risks are of discontinuing use with Xanax. So, 2 of the main effects of benzo use are tolerance and addiction. With tolerance, it basically means that you need to increase the amount of the drug to achieve the desired effect. So if you find that you start to need to take a higher dosage to get the same effect, that means you're developing a tolerance. And then there's addiction. They're intended for short-term use, so you have to be careful when it comes to addiction and tolerance. Some signs of addiction would mean that you have a strong desire to take the substance. You have an impaired capacity to control the substance taking, so that you're taking it in larger amounts or over a longer period of time than it's intended, or you have unsuccessful effort to cut down on the use of it. Those are just some signs of addiction. Now, in terms of, because it is meant to be used for short term, there are some long-term health issues that you need to be aware of. Benzodiazepines have a risk for developing dementia, which is an illness affecting the brain that causes gradual memory loss and problems with language and motor skills in the long term. So that is definitely one of the long-term effects. It's irreversible. In 2014, there was a study published that actually linked benzo use and Alzheimer's. So based on this particular study, the greater a person's cumulative dose of benzos, the higher the risk of Alzheimer's. This is only one study, but it's definitely worth noting, and they're doing more research in that area. So I think it's important to let the individuals know that there are long-term effects to taking this. Now, with older people, there definitely has to be caution used with benzodiazepines because the side effects, such as confusion, and clouded thinking can have disastrous consequences in terms of falls or fractures or car accidents. So it's definitely something that needs to be addressed with older people. So those are the risks of discontinuing the benzo use. There are definitely risks of overdose, and there is, if there is a benzodiazepine overdose, there is an injection that can be injected rapidly into the veins of flumazenil. However, with overdose, you have to be very careful to warn the individual that it can cause excessive sedation when combined with other medications that slow the brain processes. So benzos should never be mixed with alcohol, barbiturates, narcotics, and tranquilizers. The FDA has come as far as to warn and spell out that there are risks for overdose and death if they're used in combination with opioid pain medications. So these two drugs, they both affect the central nervous system. They're both depressants, and they can trigger respiratory depression, coma, and even death, especially when combined. Therefore, it's very important that the individual understand that you cannot mix opioids or alcohol together when taking these drugs. Now, the withdrawal symptoms, when you do try to taper off of benzos, they include anxiety, trouble sleeping, restlessness, muscle tension, and irritability, perceptual distortions, blurred vision, nausea, sweating, depression. So it's recommended that with benzo use, when you go to discontinue it, you use the tapering method, and it is not recommended to go cold turkey. It can be very dangerous. There's the rebound effect with in that the symptoms that you originally started to take benzos for, when you stop taking the drug, they can become more pronounced when the medication is stopped. For me, I think that's a very important thing that the individual should understand when they start taking these, that if there is that rebound effect, and that if you discontinue use, then it needs to be tapered, and that tapering process needs to be discussed and planned with the professional. Now, the final thing I wanted to touch upon with benzos, I said they're used to treat anxiety, they're for short term, they're used in terms of trying to affect the GABA neurotransmitters to calm the body's response just to potential danger. There is the danger of overdose. There's risks for discontinuing it, should be tapered off, never gone cold turkey. But finally, and most importantly, I think the individual needs to understand that these are meant for short-term relief. And that is where I think most people don't realize the danger that can involve overdosing or addiction or even building a tolerance to these. So I would definitely recommend that therapy be used with benzodiazepines, and the client should confront the underlying issues of anxiety, such as their beliefs, their fears, their feelings, and attitudes. And this will be more likely to produce a long-lasting change. The benzodiazepines are just to be used to get you to a point where you're functioning and you can attend your therapy and put the work in so that you can have this long-lasting effect. Because no amount of medication can address the cognitive, affective, or interpersonal struggles that are associated with anxiety. There are different therapies that can be used. I don't want to go into it with this presentation. However, exposure therapy, the research shows that it's underutilized and it's very, very effective with certain fears and phobias. But the client needs to know that there are other ways other than medication to address this issue. Thank you.